So GvHD is the main obstacle for successful allogeneic transplant and the main cause of mortality. And so we need to prevent GvHD. And so there are, besides the cantinorin inhibitor in combination with methotrexate and MMF, the two main strategies are ATG and PTCy. ATG, we have 30, 40 years of experience, 6 randomized studies. In all of them, there is decrease in acute and chronic GvHD, but there is no decrease in non-relapse mortality and not improve in overall survival. And PTCy that have been pioneered in haplo showed reduction in non-relapse mortality and acute GvHD. And in the American CTN 1703, in which they compared the PTCy based to the conventional methotrexate tacrolimus, they showed reduction in severe acute GvHD, chronic GvHD, and improvement in GRFS. And this is in unrelated, match unrelated, and sibling transplant. So PTCy is moving to the unrelated setting, which is the main problem we have there with GvHD. And these two strategies are available. EBMT recommendation don't recommend PTCy in sibling transplantation, and for match unrelated and mismatch unrelated, it's recommend either PTCy or ATG. And the newer data, mainly from registry-based study, we don't have a randomized study, are all of them showing, or most of them will show, at least in the mismatch unrelated and some in the match unrelated, advantage of PTCy as for acute GvHD and non-relapse mortality. And it's less so in siblings. So I would say that the more there is HLA disparity, you have a more place for PTCy over ATG. And we need a randomized study. The future direction is combining the two in order that we can reduce the doses of ATG and PTCy and have less toxicity. Also, we may have more efficacy. And because the dose and the timing is not decided for ATG, but also for PTCy, we are reducing the doses in order not to have cardiac toxicity or hemorrhagic cystitis. And we need to make endpoint of the patient quality of life and to see that we are not increasing infection and relapse rate. Currently, with the combination of PTCy to ATG, there is a decrease in acute GvHD in some of the study without increase in relapse or infection.